Last year, a healthy 74-year-old woman walked into a routine checkup on her own 2 feet. 9 months later, she couldn't walk to her own mailbox without help. Nobody made a mistake. No one was negligent. She simply said yes to a test that most people say yes to without thinking twice. I'm Dr. James Carter, and after 60 years treating patients over 60, I'm going to name 4 specific tests that I believe do more harm than good after age 65. Tests your doctor may order this year without a second thought. By the end of this video, you'll know the exact one-sentence question that could save you from a hospital bed you never needed to be in. Stay with me, because test number 4 is the one that scares me the most. Before the list, you need one idea in your head. I call it the domino effect. A scan finds a shadow. The shadow needs a closer look. The closer look needs a specialist. The specialist wants a small procedure just to confirm. The procedure has a complication. The complication needs treatment. 6 months later, someone who walked in feeling perfectly fine walks out with 3 new diagnoses and a walker. That's not a rare story. That's Tuesday in clinics across this country. B-roll, simple domino animation, one tile falling into the next. Here's the part almost nobody tells you. Most screening guidelines were built using data from people in their 40s and 50s, then simply stretched upward to apply to people in their 80s. Nobody rechecked the math for an older, more fragile body. That gap is where today's 4 tests live. Full-body CT scans are marketed as the ultimate health checkup. Scan everything, know everything, worry about nothing. Here's the catch. Scan any body over 65 from head to pelvis, and you will almost always find something. Not disease, just the ordinary wear of decades of living. A lung spot that's been harmless since your 40s. A liver cyst that will never cause a symptom in your lifetime. But once it's on paper, your doctor is professionally required to chase it. That chase often means repeat scans every 6 months, sometimes a biopsy. And biopsies in older lungs carry real risk of bleeding or collapse. One scan's radiation dose alone equals roughly 3 years of natural background exposure, and older cells repair that damage more slowly than younger ones. The question to ask, do I actually have a symptom this scan is meant to investigate? If the answer is no, pause before saying yes. DEXA bone scans are genuinely valuable in your 60s. Catch low bone density early, and you can act on it for a decade. Past 80 though, the equation flips. A low score at 80 usually leads straight to a bisphosphonate prescription, and that drug class carries 2 rare but frightening risks in the very elderly. Atypical fractures of the thigh bone that happen with almost no force, and a jawbone condition that can follow routine dental work. Here's what actually prevents hip fractures at that age. Fixing the fall risk, not the scan number. Balance training, a home safety check, a review of every medication that causes dizziness. These have stronger evidence than the pill does. The question, will this scan actually change my treatment beyond what a fall prevention check would already recommend? Quick pause. If you've made it this far, you're exactly the person this video is for, and you're also exactly the type of viewer who scrolls away without hitting subscribe. I'm about to name the test with the highest risk of all 4. If you want it in your feed the moment it drops, subscribe now. It takes 1 second, and I read every comment. Okay, let's keep going. The arteries in your neck can build up plaque over decades. Routine ultrasound scans them for stroke risk, even with 0 symptoms. Sounds smart. Find the blockage. Fix it before disaster. Here's the twist. The surgery used to clear that blockage can itself cause the exact stroke it was meant to prevent. Multiple large trials found that in people with no symptoms, the stroke risk from the surgery can equal or beat the risk of simply managing blood pressure and cholesterol with medication and doing nothing invasive at all. Major heart health guidelines don't recommend routine carotid screening in symptom-free adults, yet it still gets ordered, constantly. The question, if this finds narrowing, what's the stroke risk of the surgery, compared to the stroke risk of just optimizing my medication? Give me both numbers. This is the one that worries me most. No chest pain, no shortness of breath, no fainting, just a routine stress test, and it comes back abnormal. The next step is often catheterization, a tube threaded into your heart's arteries to look directly at the blockages. It sounds precise and reassuring. It is also genuinely invasive. Bleeding, artery damage, contrast dye that can injure aging kidneys, and a small but real stroke risk from the procedure itself. Here's the finding that should be on every waiting room wall. 2 landmark trials published in a major medical journal followed patients with stable heart disease and no real symptoms. Aggressive intervention, stents, bypass, did not reduce heart attacks or deaths compared to medication alone. Same protection. Far less risk. And stress tests have a notably high false positive rate in older adults, especially women, meaning this whole chain can start from a signal that was never really there. The question, do I have symptoms? And if not, what does the evidence say about people like me managed with medication versus the procedure? Remember the woman from the opening? I'll call her Margaret. Her original finding, the one that started 9 months of scans, referrals, a procedure, a bleed, a dizziness-causing medication, and finally a fall that broke her hip, turned out to be nothing. Clinically insignificant. It was never going to hurt her. The test didn't harm her. The chase did. During her recovery, she asked me one question I now give to every patient before every screening. If I'd known to ask one thing beforehand, what should it have been? My answer every time: if this test finds something, what will we actually do about it? And is doing that worth it at my age, in my current health? That single sentence forces the conversation the system doesn't have automatically. It puts you back in the driver's seat. 4 tests worth pausing on after 65. Full body CT scans that manufacture false alarms, bone density scans past 80 that can trade one risk for another, carotid ultrasounds that can trigger a stroke while trying to prevent one, and cardiac catheterization after a symptom-free positive stress test, where the evidence says medication alone often does the same job. To be crystal clear, this is not skip your doctor. Blood pressure checks, diabetes management, vaccines, vision and hearing screens, these save lives, full stop. What changes is this: walk into every screening appointment with one question ready. If this finds something, what will we do? And is it worth doing at my age? Write it on your phone if you have to. Which of these 4 surprised you the most? Tell me in the comments. I read every single one. And if a routine test ever sent you down a chain reaction you didn't expect, share it below. It might be exactly what someone else needs to read before their next appointment. Send this to someone over 65 who says yes to every screening without asking a single question. Subscribe for more honest, evidence-based conversations that put you back in control of your own care. Disclaimer: read as is or overlay as text. This video shares general medical information based on published research and clinical guidelines. It is not personal medical advice. Individual health histories vary, and some people have specific reasons these screenings remain appropriate for them despite age. Talk to your own physician before changing any part of your care plan. This video is meant to start that conversation, not replace it.